HIV is a virus that primarily infects cells of the immune system and that causes AIDS. AIDS is a fatal disease that results from HIV infection. AIDS is a worldwide epidemic that continues to spread. An estimated 850,000 to 900,000 Americans are living with HIV infection today. Teenagers are one of the fastest growing groups with HIV and AIDS because they engage in high-risk behaviors. HIV primarily infects important immune cells called helper T cells. HIV is not spread by casual contact. Teens are at risk for HIV infection if they engage in high-risk behavior. HIV can be prevented by abstinence and avoiding the high-risk behaviors known to transmit HIV. If a person has engaged in any behaviors that put him or her at risk for an HIV infection, he or she should get an HIV antibody test. How do you get HIV?
It's transmitted from you sexually by a carrier.
And how is HIV spread?
From carrier to carrier.
Good job. T cells drop.
I have no idea.
You're more likely to get AIDS faster. How do you prevent HIV?
Abstinence?
And how do you eliminate the risk of getting HIV?
Abstinence and not sharing needles.
Good job. When was HIV first discovered?
I want to say it was in the 70s or 80s.
The 1980s. Good job. Is there a cure for AIDS?
There's not a cure for AIDS, there's a treatment for AIDS. It's what they call the AIDS cocktail. It's a mixture of 3 medications. I don't know the name of them.
Okay. How many teens or young adults are living with HIV infection today?
Is that in the developed world or the developing world?
The developing world.
Developing world, probably 60%.
It says 30 of the 40 million.
So 75%. Okay.
Yeah.
That's a lot.
Yep. How does someone live with HIV?
Exercise, maintaining their health, and a lot of rest can slow the progression of the disease.
Good job. Okay. And then lastly, what are the phases and symptoms of HIV infection?
I don't know.
Phase 1 is few or no symptoms. This phase can last up to 10 years. Phase 2 is symptoms worsen. And phase 3 is the beginning of AIDS.
That sounds